All right, we're going to go ahead and get ourselves started here. Thank you for the 2024 legislative session and budget breakdown. We are recording this, so if you have colleagues who couldn't make it today, we will make this available. We'll upload it to our YouTube channel. We are really excited to bring you some of the legislative outcomes from this past legislative session. Before we jump into it, just a quick overview of who we are. We recently updated our Voices vision and mission. And our new vision is we envision a Virginia in which our systems center young people, ensuring their ability to realize their brightest potential is no longer predictable by race, socioeconomic status, or geography. And our refreshed mission is that we champion public policies and legislation that achieve positive and equitable outcomes for young people. So a lot of our policies that we are either supporting or monitor this legislative session are in alignment with the vision that we are, the journey that we're on. So a quick introduction of our team. I am Allison Gilbreth. I use she, her, hers pronouns. I'm the Senior Director of Policy and Programs. My areas that I focus on are child welfare and early childhood education, or early care and education. And I've been at Voices, I think 8 years now. So hello to lots of you that I've known for quite a while now, but I've more recently taken on the early care and education portfolio. Pass it to you, Emily.
Hey folks, good morning. Emily Moore, I use she, her pronouns, and I am the Senior Policy Analyst here at Voices. I cover our health equity and our economic security work, which encompasses our food access and our tax fairness work. And I have been at Voices for about 2 years now. Throwing it over to you, Kat.
Thanks, Emily. Hi, everyone. My name is Kat Atkinson. I use she, her pronouns. I am the newest member on this team. I've been here for about 6 months. I am our policy analyst that covers all things youth mental health. So anyone ages 0 to 26, we are looking at policies that help improve outcomes and wellness for young people.
And at the end of our presentation, we will provide our contact information in case you want to reach out to any of us individually. So I'm going to kick things off with early care and education. This has been a really monumental year for early care and education. So I'm really excited to bring you all some of the outcomes of the legislation. So the first bill that I want to talk about is House Bill 419. This was companioned by Senator Locke's bill, Senate Bill 54. These were funding formula bills that really will help us transform the early system. In very simple terms, which is the purpose of this webinar, this bill will create, for the first time, it will require the state to determine how much it would cost to actually pay for all of the need for early care and education in Virginia. So we've always advocated for fully funding, but we actually don't require the state to do the funding, do the formula for that. So it's going to completely change how we fund early childhood education because it will be based on real numbers of children in Virginia. It also creates a non-reverting fund, which is a complicated way of saying if there are unspent dollars in early care and education, which I'm sure many of you are familiar with, that sometimes happens, it requires that money go back into early care and education. It can't be allocated to another system in state government or in another part of the state budget. So this is going to also be really excellent, and it should over time help us fine tune how we fund early care and education. What you're gonna see over the next probably 2 to 3 years is a lot of fine tuning. Okay, we need more money in mixed delivery, for example, which I'm an advocate for, but we'll see those fine tunes, or this in subsidy. The goal here for the early care and education ecosystem is we want to ensure that the public sector and the private sector work together and that one doesn't alter the system within the ecosystem of early care and education. What we don't want is for families to, one, not have choices available to them, and two, we also don't want to put a wonderful early care and education facility out of business because we're pouring everything into the public system. We really want to go about it where it works for everyone, both for the private providers, public pre-K and through in early Head Start. So I'm really excited about the implementation of this bill. You're not going to see anything right away, but moving forward, you will. So moving us along to Senate Bill 13, which was patroned by Senator Favola and Delegate Reeser, who had the same companion bills. This provides licensure for child day programs and the use of office buildings. So we also want to encourage, mostly a lot of this was created for small businesses, for them to be able to create child day programs in their businesses, in their office buildings. So this allows for them to go and apply for a use of office buildings through the child day program in Virginia. Again, a great step in the right direction. The next one is House Bill 472. This is patroned by Delegate Gardner. This is her first legislative session. So, but just so any folks on this call know, for Delegate Gardner, she previously was the director of the Department of Social Services. So really gets a lot of the issues that we are advocating for. This repealed the provisions, excuse me, related to childcare services in relation to TANF. So for a lot of folks who've done case management know that there's so many things that you're not eligible for if you're getting cash assistance. So this repealed some of those provisions for folks who are receiving to be able to receive childcare services while also receiving TANF. And House Bill 407 was carried by Delegate Hernandez. This is the child care subsidy program, and it created a categorical eligibility for certain families. This bill is really, really narrow in scope, so I'm not going to go into full detail, but it'll impact some families. One bill that did not pass this year was House Bill 1216. This was patroned by Delegate McClure, also brand new to the General Assembly. This was the Employee Child Care Assistance Program and Fund. This would have allowed for small businesses to start a fund to pay for childcare for some of their employees. We know that childcare, of course, is a huge barrier to some folks entering the workforce. There was not the true issue here was just funding. Members were very supportive. It got much further along in the General Assembly process than I thought it was going to originally. The fiscal cost, it would have required the state to make some initial payments so that the employer could match it. So Delegate McClure is dedicated to bringing this bill back around next legislative session. So I think we are really on a pathway to creating so many different opportunities for families moving forward. And now for the more exciting part of early care and education, which is the budget. There is nearly 1.1 billion with a B investments in early care and education this legislative session. Really, really exciting stuff. While I'm very excited, I do want to make it very clear that a lot of the funding that I'm going to talk about are dollars that we would not have continued to receive from the COVID federal dollars that Virginia received. So when COVID hit, the federal government started pouring millions of dollars into the Commonwealth. Everyone was like, this is exactly what we needed. Then they took that money away, and we are thankful that the state replaced those dollars and added some to it. So we're not going to see like huge increases, but we're going to see sustainability and a pathway forward. So in childcare subsidy, there's a little over 500 million that is being invested in childcare subsidy. This amount also indicates an increase for providers moving forward. For mixed delivery, there is 77 million. And I want to be clear, this is over the biennium. So this is 2 years worth of funding. We love mixed delivery and would love to see this to be continued to be expanded, this pot of dollars, but we are really excited about the 77 million moving forward. VPI per pupil amount is 271 million over the biennium. And then in coinciding with that, there is 66 million for VPI expansion. So what you will see over the next 2 years is you will see a lot of the VPI programs expanding into 2- and 3-year-olds. So for example, I live in Chesterfield County. VPI is only for 4-year-olds here. They might take up the opportunity to expand 3-year-olds into their county. And that what will be really nice about that is if that's paired well with the mixed delivery, we're going to get to a place where we're able to serve at 40-50% of the kids eligible in that in one of those programs, whether it's in VPI or a mixed delivery, and families would have the opportunity to choose what is the right fit for them. The Early Childhood Capital Fund. So this, when the governor did that big building blocks for Virginia, this was originally at like 14 million and was reduced to 1 million. So there isn't as much dollars as that we were hoping for. And instead, this is just a kind of strange, but it's $1 million, but it's very specific to building a early childhood CDC on the campus of Reynolds Community College. They weren't even sure how that happened, but they're like, okay, I guess we are opening a facility in at Reynolds. So not sure. And then $20 million for the B5 program. So overall, we are just really thrilled with the progress. We are going to be having a celebratory event on July 15th at the Children's Museum of Richmond. Details are, we are trying to get this invitation out as quickly as possible, but it probably won't be until today or Tuesday of next week. But we are really excited to just celebrate all of the hard work. So many people participated in advocacy days. Truly, a lot of this credit goes to my predecessor, Emily Griffey, who did a lot of work in the early care and education space. And we're really grateful to our partners at the state. Jenna, for example, just did a lot of work to do this. And thanks to everyone who's a part of the Virginia Promise Partnership. So I'm going to transition us over to child welfare. This also, we had some really awesome successes for things that we have been working on for a really long time. So I'm going to start with House Bill 893. This is for anyone who's familiar with the Guardian ad litem process, and we're going to be working over the next several years to really. So this is more so taking a bite at the apple. But House Bill 893 requires some standards for attorneys who are appointed to represent parents of or guardians in child dependency cases. There are things that the judge now has to say, okay, did you actually meet with the child? X, Y, and Z, these things have to be checked off in order for you to remain on the case. A bill that we have worked for almost a decade is House Bill 27. There's also, it says Senate Bill 39, but it's the same bill. This is Delegate Carlson, who is new if you're in the Charlottesville area. She was a DSS attorney up until like 2 months ago. So she's very familiar with the child welfare system if you're in that area. And Senator Frivola, who's been a huge advocate of ours for a very long time, we were able to pass the Kinship as Foster Care Prevention Program. Hooray, hooray. We are so excited. This program will finally allow for kinship, kin and fictive kin to take custody of their relative children with the support of DSS. So they will receive case management services, and they will see financial assistance that is at least equivalent to a foster care payment, so around $800 a month. A huge step in the right direction. This program goes into effect July 1st. So we are anticipating a significant increase in kinship placements in Virginia. The state has set a very big goal of exceeding the national average of 30% of placements to be with kin. They want some localities to get closer to 50%. I say awesome. It's probably going to take some time to get there, but I think when we're able to combine the services and the financial assistance, we can get there. And I think for private providers like DePaul, this presents a really awesome opportunity to support kinship families in a different way, that are going to have some DSS involvement, and they will need supports in different ways. House Bill 777 with Delegate Carlson is about the enrollment of students who are in kinship or foster care placement. This now requires by law that if they have a transition from one placement to another during the school year, they are allowed to stay in their home school. So they don't have to move from school to school unless it benefits everyone. We certainly don't want anyone driving an hour to school if they don't want to, but it provides one more opportunity for some continuity for children. Senate Bill 115, unfortunately, was vetoed by the governor, even though it had bipartisan support in the House and the Senate. This would have made it so that if a parent tested positive for marijuana, they would not be denied visitation. We're really disappointed to see that vetoed by the governor, given it kind of is in conflict with state law, given the changes that have been made in Virginia. And it was just unexpected because there was some really awesome folks on both sides of the aisle that really asked deep, meaningful questions and really understood at the end of the day that this was creating more harm for children who their parents were doing so much to either regain custody or have visitation. So we will be bringing that bill back around next legislative session. The next bill is House Bill 453. This is the barrier crime bill that if you followed our work, you'll know we have worked on some sort of barrier crime bill in child welfare for the better part of 10 years. This doesn't do all the things that we want, but it does reduce the barrier crimes from 10 years to 5 years, which is definitely a step in the right direction. It doesn't impact all of the barrier crimes that we wanted, but again, a step in the right direction. Next bill is House Bill 1313 with Delegate Tata. If you're in the Tidewater, Virginia Beach area, advocate for child welfare from Delegate Tata. This bill was laid on the table, but I wasn't surprised at all. This would have expanded the Fostering Futures program from 21 to 26, which we think is a great idea. She didn't really, we didn't have the opportunity to do front end policy work here. This is like millions and millions of dollars in expenses to do that. I think that we might, we'll have a conversation with her and maybe we start with increasing it to 23 or something like that, like taking some bites at the apples to get us there. And then the next bill that also didn't make it was House Bill 587 with Delegate McClure. This bill was going to study unaccompanied youth in Virginia and look at the Department of Social Services and the Department of Housing to do some work there. This was unfortunately continued to 2025. They basically decided that all studies were not going to pass this legislative session, which really stinks. Although some studies did pass, which you'll hear from my colleagues earlier, but this was not their first time asking for those studies. Getting into the child welfare budget items, there is, they funded $7 million for a 7% increase for cost of living for foster care and adoption, which we are really excited about. They also increased the local staff and operations salaries. We have been asking for increases to local DSS staff salaries for a long time. If you're not familiar, DSS has an average turnover rate of about 40% within the first 2 years, which makes it almost impossible to have a workforce that really knows the system well. And a big part of that is salaries. Like you can go, the comparison we often hear, especially in rural communities, is they can work at Hobby Lobby and make the same salary and they don't have to have any of the really hard stress and trauma. So we will continually every year ask for increases to salaries, and they've sort of been taking a 5% approach over the past few years. They did fund the child welfare forecast at $3.2 million. The next thing, we are really excited. They have put in $5.5 million for the training academy for social service employees. This is really going to be a huge transformative process. Instead of hitting the ground running your first case, you will go to a training academy and have the opportunity to get appropriate supervision and practice with there'll be actors, but they will pretend to be families, and your supervisor will give you feedback of how you could have done things better or differently, or different things. There's 1.3 million that's being transferred from the Department of Housing and Community Development to support youth who are aging out of foster care, to support them with housing. The next one, this is like 7 years in the process, but we've finally got funding for driver's license for youth in foster care. For those of you who work with young people in care, you'll know that probably one of the biggest things that they care about most deeply is getting their driver's license. The Commission on Youth did a study a couple years ago. Only 3% of youth in care were actually getting their driver's license, compared to, I think it was 74% of, excuse me, youth not in care. So this 620,000 is going to pay for two big things. One, those fees that you pay when you get your driver's license, but it's also going to give a reimbursement for car insurance. The biggest barrier for youth in care was their car insurance. And it's very, very expensive to be 18 or 19 years old and not have a parent or caregivers to be on their policy with them. So we're really excited about that. There's $500,000 to fund First consultants. A lot of transformation is happening in the system, and they really needed some consultation. There is $1 million to support Foster Youth and Great Expectations program. This is the program on community college campuses that mentor and coach youth in care. We are really excited that they are getting some state dollars to do this work. One of the most impactful things youth tell us is about great expectations. The next thing is 6.3 million for child dependency cases for court-appointed attorneys. I spoke a little bit earlier about the need for better compensation for court-appointed attorneys. Currently, attorneys are only paid $120 for the life of their case. Let me repeat that, the entirety of the case. We did a small increase. It's not everything that we wanted. So we'll increase to $330. This will be delayed for 6 months, and they will receive an additional $680 if they are representing in a termination of parental rights case. And then there is $3 million for pilot programs that increase the number of foster children adopted. The language in the budget wasn't prescriptive, so I imagine the Department of Social Services will kind of figure out and look at different opportunities for them to do this work. So a lot of progress in the child welfare system. I have not been keeping up with the chat, so if there are questions, okay, I don't think so. If you do have questions throughout the presentation, please put them in the chat. If we can, we'll pause and answer them. If not, we will take all the rest of the questions at the end. Thank you for listening, and I'm with the wrong way. Gonna pass it over to my colleague, Kat, for school-based mental health.
Thanks, Allison. So school-based mental health is becoming a bigger conversation, and we're really bringing up a lot of education during this session around the needs for school-based mental health services, being that schools are where our young people spend a significant amount of time. So some of these bills, we got some great ones that passed, but still need some continued work. And then we had quite a few that were vetoed that would have made a lot of progress for our young people. So I'll run through these pretty quickly. HB 224 from Delegate Hinson would have improved our mental health awareness training for school staff to include students who are at a higher risk of mental health challenges. So that includes LGBTQIA plus students, students in foster care, those who've been bereaved by suicide in their families. And this was vetoed by the governor because of the language around LGBTQIA plus students. HB 603, which has passed, which I'm super excited about, will be including a mental health curriculum in our public schools physical education courses. So the DOE and the board will be working to develop this curriculum from the K through 12, and it'll be, you know, developmentally appropriate. So I'm looking forward to seeing how this is implemented. HB 919 by Delegate Srinivasan has us developing a model memorandum of understanding for school divisions to be able to contract with a nationally certified telemental health provider. This is a bill that will allow schools to contract once this MOU is created, but is not required. So this is a great step for us to have something pretty standardized on how we will be able to implement telehealth in schools. HB 395 was continued to the 2025 session, and this one will look at how do we add additional screenings for students, mental health screenings, and this was going to be implemented in physical assessments for students to be able to play sports. So there was some conversation around, you know, how this could be implemented in practice, and so we're going to continue to work on this through the summer and into next session. SB 586 and HB 398 was vetoed, and this was going to improve our restorative practices in schools. So essentially not moving straight to expulsion when students have behavioral issues in the classroom, but rather allowing us to ensure that we are trying out various types of restorative measures to allow a student to continue being in school and being supported by the school while concurrently getting those behavioral health supports. And then lastly, we have these three bills that all were focused on student supports and counselor ratios. All of the ratio bills were incorporated into these larger bills that focused on the at-risk program in schools. So sending funding into various schools with higher levels of needs to meet kind of various different levels of like standards of quality and things like that, that would ensure that they have the right staff, the right folks who would be able to meet the needs of students. And in the end, the incorporated bills were vetoed by the governor. So moving on to some of the school-based mental health funding, you can kind of see it all here. We have funding that was allocated to provide grants to school divisions to implement school-based health centers, and these will include mental health services. This was funding that was originally allocated for the school-based mental health pilot that had schools able to contract with community-based providers to provide mental health services in schools. So now that funding is being reallocated to school-based health centers. Concurrently, we have a language that was added to the budget where Department of Education, the Department of Medical Assistance, and the Department of Behavioral Health will work to develop a plan to send better funding and more flexible funding to school divisions to implement school-based mental health services. So that money that will go into a report that we will see by the end of the year, and hopefully we'll get some new flexible funds to our schools. And then we have some funding to implement some recovery high schools in these different areas of the state. And you can see that we had some telemental health funding that was not included in our budget this year. And I really hope that we can bring that back around, considering we have some language in our code that allows schools to contract with telemental health providers. I'm going to quickly go through some crisis stuff. I want to make sure we have enough time for Emily to chat about her areas. So in crisis, we have a huge, there was a huge push for crisis mental health services this year. I'm really excited about the work that was done to improve our our crisis continuum just generally. I will say that most crisis specific bills did not specifically include young people in the language, and generally we're focused on adults. But these are some of the ones that might connect with young people in some capacity. So SB 569 is focused on creating a work group that will have us look at seclusion in the crisis receiving centers and just making sure that it is healing and not, and just kind of just making sure that if we're using seclusion, there is a reason why we're using it. The next two bills, SB 460 and HB 772, are focused on admission of minors into inpatient treatment facilities. So it codifies specifically that young people can be admitted into inpatient facilities for substance use disorders or substance use needs. And it takes away the need for a temporary detention order if a young person who is objecting to going to an inpatient facility, even though the evaluators determined that that is something that needs to happen, that if a parent agrees to admit a child into these facilities, that a TDO is not necessary in those cases. This is definitely one that we're curious about how it's going to be implemented. There can be some unintended consequences to this. So we're definitely going to be paying attention to the implementation of this moving forward. The next two, SB 543 and HB 601, allows private insurance to bill for emergency services, including mobile crisis response services. You know, we see a lot of work focused on Medicaid and some of those areas. So it is cool to see that our private insurance companies are also going to be really hyper-focused on those emergency mental health services in the same capacity as Medicaid. These next two bills are Behavioral Health Commission bills, and they are focused on when an individual is going through an emergency custody order or a temporary detention order. So they are at risk to themselves or another person. An evaluator can determine if that individual's guardian is able to be present for the evaluation. But there were some changes added during session that really specified that if a presence of another individual could create a risk to the patient, or the patient says that they do not want somebody in the room with the evaluation, then then no one will be able to be present. But this was in conversation with some issues that happened over the last year with a patient who did not have the support that they needed from a guardian in an evaluation for an ECO and a TDO. And then lastly, these two bills we worked on specifically with these patrons. They came from the perspective that a lot of schools do not have the knowledge or understanding of when a young person who has been discharged from an inpatient treatment facility was coming back to school, and it would have provided discharge plans to elementary and secondary schools just openly, like the inpatient treatment facility would send those plans to the schools. And as it was presented to the GA, that was not something we were comfortable with, especially for a young person to not have any consent to their information being provided to a school. So we spent some time working on it. In the end, it did not pass. We could not get it to a place that all stakeholders were happy with the language in the bill. So this will be continued to 2025. And some more conversation will be had around how we can ensure that schools are able to support students who need it, but students and families are able to have consent around what their information will be provided to. Lots of funding here for crisis, just keeping an eye on the time. I'm not going to run through this, but we saw all of this is just significant increases to our 988 crisis line. We have funding for mobile crisis teams, some pretty significant increases for the Right Help Right Now crisis services, and inflation adjustments for various steps for the STEP VA program. We're seeing some funding in here for different crisis intervention teams. So we have our crisis intervention trained workforce. So this will be various professionals who meet emergency needs and are able to get trained on some of those trauma-informed practices when they go out and have to, meet with different people who might be going through crises. And then our crisis co-responder programs, this funding will, ensure that folks like law enforcement who might be going out with a social worker or a psychologist or a crisis responder is able to have the same baseline level of knowledge around how we meet crises and emergencies. And so we're really excited for this funding that has come out, as well as some language around how we use children's psychiatry and crisis funding to be flexible for various needs. So our CSBs and our behavioral health authorities are able to meet young people's needs no matter what. Awesome. So we can move on to the next one. Workforce, we are really excited that Virginia is now going to be able to join the social work licensure compact. So that means that states are going to be able to, various states in the compact will be able to essentially share shared licensed social workers, and they're going to be able to meet various needs in the state of Virginia. So that is our first one. And then there was a lot of language around how we're going to address the mental health workforce shortage just generally. So these bills, all of the bills that failed to report, either looked at how we licensed for social work, because there's a lot of barriers to licensure that really make it difficult for us to bring on new talent in the workforce and engage folks who maybe are not your standard that you see when you see a social worker. So people of color, things like that. We also saw a bill that HB 37, which was to improve or create a loan repayment program for just general mental health professionals, not those who are licensed. That was laid on the table. And then HB 1293 and then SB 155 and HB 1499, both were focused on the Virginia Health Workforce Development Authority. And we're really going to look at how do we meet the needs and really recruit and retain folks in our mental health professional system. And we have a lot of work to do there, and seeing that so many of our bills around workforce did not pass this year, we have a lot more work to do moving forward. And then in terms of budget items, you can see here we had some increases to how we meet the needs of licensure through residencies and helping fund some of those residencies for psychiatrists, some loan repayment program increases. So we have got two here for clinical training sites. We have some funding around how we bring mental health training into our hospitals and into our medical professionals to be able to kind of meet some of those universal mental health needs. So that's in the VMAP program. And then additionally, the State Council for Higher Education of Virginia's mental health workforce program was this funding is to help folks who want to go to school for mental health and behavioral health training can get some additional funds to be able to join our workforce, our mental health workforce. So definitely can expand more on this if anyone has any questions, but you'll see my email at the end and we can talk a little bit more specifically about some of these items if you have any interest. So thank you so much. I'm going to pass it to Emily.
All right. Hi, everybody. I'm going to be covering our economic security and our health equity, and recognizing the time, I'm going to need to go a little quickly through some of this, but we will be producing blogs and some outcomes documents, and they will be posted by the end of the month, early July, so you can find out some more specific details. So let's dive right into economic security. As you see here, sadly, many of our efforts to support the economic needs of families and children did not fare well this General Assembly session. The efforts of Delegate Ward and Senator Lucas to continue Virginia's minimum wage increases were vetoed by the governor. This would have increased the minimum wage to $15 an hour ultimately. There is some language in the current budget that allows inflation increases to our minimum wage, so we won't be stagnant. However, it is not the progress that we had hoped this year. So suspect that we will continue working on that moving forward. Sadly, paid family and medical leave was ultimately vetoed by the governor. We worked with our partners at Freedom Virginia and the Paid Family and Medical Leave Coalition to compromise on this, to scale it down from 12 weeks of paid family and medical leave to 8 weeks of paid family and medical leave. We also compromised to carve out state employees because state employees already have access to paid leave in some instances. And so our compromise bill, unfortunately, was still vetoed. And we continue to work towards this as a priority. And I am actually working on a policy brief on paid family and medical leave and its implications as a health equity tool, as well as an economic security tool. So stay tuned later in the summer for that to help shape the narrative around how this is really a tool to support families and children directly. We were also really sad to see HB 992 by Delegate Tran vetoed. This was a Section 1 bill, which means it really just directs the Department of Social Services and the local workforce development boards to work together to help folks achieve meaningful employment, careers, rather than what a lot of folks typically are filtered into through some of our workforce development programs, which are temporary job agencies and jobs that don't turn out to be long-term career prospects for them. So this was a recommendation of the JLARC's self-sufficiency report to have our LDSS and workforce folks working together because the workforce development boards have the staffing, the tools, the resources to connect folks with those jobs. And so this was vetoed because we worked on a substitute and amendment to make the language so that families that were not participating in SNAP employment and training, but were just participating in SNAP would not be held liable for not participating in a workforce development program. That's not a requirement of traditional SNAP, just a requirement of employment and training. And we wanted to clarify that in the language so that this would not be used to create mandated work requirements for families receiving safety net benefits. So we'll continue working with Delegate Tran to make this a robust bill and working with our folks at the Department of Social Services to bring this back next year. And sadly, paid sick leave was continued to 2025. This would establish a mandate for all employers, regardless of whether their employees are full-time or paid time, or full-time or part-time, to have access to paid sick leave days so that they can care for themselves when they're unwell, they can care for their children when they are unwell. And we will continue this into next session as well. We did thankfully get a study required in our budget for paid family and medical leave. So this will look at the update to the 2021 study that was done on paid family and medical leave to see what the cost to the state would be to include state employees in the larger paid family and medical leave policy and what it would look like to expand that to 12 weeks rather than 8 weeks. And we look forward to seeing the recommendations of that in December. Next slide, please. Food access had a pretty successful year in our General Assembly, albeit not as far as we would like to go, but we've seen a lot of movement on some studies that will help us to really kind of have a better understanding of the state of food access and opportunities here in Virginia. So the Virginia Commission to End Hunger from Delegate Price has passed. This is a really exciting opportunity for folks that are doing food access work across the state to come together and to be able to talk about initiatives to reduce poverty, to reduce food insecurity, and address those needs holistically. And the great thing about this commission is that the code mandates the inclusion of one high school junior or senior. So we'll have youth voice on that commission and really excited. In the interest of time, I'm not going to go through all of these, but you will see that we have the passage of a farm to school program task force, a study of food security on college campuses, This started out as the Hunger Free Campus Grant Program by Delegate Cousins and Delegate Simons. Unfortunately, was turned into a study to see how college campuses are addressing food insecurity and to share those learnings with other universities and colleges so that they too can implement some of those programs on their campuses. And a work group to study healthy school meals for all, which we are really excited about. Unfortunately, it did not, that means that we did not pass universal school meals for all students, but we believe that this work group and this study will give us more robust localized data so that we can understand the true costs of school meals for all. We did get the administrative funding for summer EBT. I don't want to go into too much detail because VDSS is working really, really hard to flesh out this program, and we don't want to get too far ahead of this, ahead of them on this. But this summer, families will be seeing $120 in a lump sum for their children who are eligible for free and reduced price school meals, or who are what's considered directly certified through programs like SNAP and TANF and Medicaid. All the details are being worked out. So we promise once we have the go ahead from VDSS, we will share with folks how families can access this. Some students will be automatically eligible and some will have to apply. So stay tuned on that. And then excited for a reimbursement for school breakfast. This will save our school divisions millions of dollars and allows the state to kind of make up some of that cost that they don't receive from federal reimbursements. And again, sad to not see healthy school meals for all or our food as medicine Medicaid benefits, but we continue to work with our state agencies and our partners on those priorities. Next slide, please. Really quickly through tax fairness, we saw this session. Unfortunately, we were not able to pass a state level child tax credit or expand the refundable state earned income tax credit to 20% of the federal credit. But you can see down in the budget, we do have a study of Virginia's tax code that will be taking place through a joint subcommittee on tax policy. And they're going to be looking at ways that we can make our tax structure more geared towards families. We have an upside down tax code. It is a regressive tax code. And we are really looking at ways to modernize that and to include how we might be able to support families better through tax credits, such as the state level CTC and expanding that earned income tax credit. So this is something Voices continues to work with our partners at PCI, the Commonwealth Institute on, and we really look forward to educating our lawmakers in that joint subcommittee on the importance of investing in families through a fair tax structure. Next slide, please. And health equity, we had a big year for health equity. Sadly, it also came with some concessions and having to understand that in the process of Medicaid unwinding, with folks losing their healthcare coverage currently through the redetermination process, we are still really trying to identify what our Medicaid forecast is, how much it's going to cost the state, what reimbursements we get from the federal government. So there's a lot of things happening behind the scenes with some of our health equity work in terms of healthcare coverage. We are sad to say that our unconscious bias training bill was ultimately vetoed by the governor because we rejected the amendments to make it a check the box training. This is a training that was designed to be evidence-based, designed to address unconscious bias as well as cultural responsiveness and cultural competencies for all medical providers that are licensed by the Board of Medicine. And the narrow scope that it was amended to did not meet the needs of Virginians in their healthcare journey, especially in our maternal health space, where we know that the maternal mortality rate is far greater for Black women than it is for white women. And so we will continue working on that through our PUSH coalition and bringing that back. Similarly, the Task Force on Maternal Health Data and Quality Measures was vetoed, but it appears that that will still continue just through a different avenue through the Secretary's office rather than through code language. And Cover All Kids, which we have been working on for 3 or 4 years now, was laid on the table in appropriations. This will create a state health insurance program for children that otherwise don't qualify for Medicaid due to their immigration status. And so we are working to ensure that all children, regardless of immigration status, that are eligible to have health coverage are able to access this. And so you can see some other wins that we have here around private health insurance coverage for doula services and Medicaid coverage for ultrasound procedures and fetal stress tests. And just grateful for our maternal health colleagues that are working hard to expand access for folks that live in maternal health deserts. And then, as you can see here, lots of investments in the budget. Won't go through them line by line, but we are really glad to see community health workers being sustained in local health districts. They similarly were funded through the pandemic through some federal funding, and when that funding went away, they were at risk of losing their jobs. And we know that our community health workers are the true public health workers that are bridging the gap between services that are not always accessible to communities that really need them. So really glad to see them being able to maintain their level of funding and hope to be able to work towards Medicaid reimbursement so that there's a long-term sustainable financing model to support community health workers across the state. And I will stop there so that we've got some time for any questions. But again, happy to chat through any of the details because we covered a lot in a very short amount of time. Passing it back to you to close us out, Allison.
Yeah, thank you, Emily. Thanks everyone for staying with us. Our email addresses are right here. I bring together folks for the Foster Care Policy Network. So if you're interested in getting involved in that, please email me. Emily is in the process of revamping some of her policy networks. So if you're interested in getting more plugged into her areas, reach out to her. And then Kat as well for youth mental health. We also just want to make sure everyone saw in the chat box, Kat Atkinson recently published the Toward Wellness, the status of school-based mental health. This is a really in-depth report on school-based mental health. Thanks, Emily, for plugging that back in. We'd love for you to get a chance to take a peek at it. And thank you, Delegate Watts. And at this point, we'd love to answer any questions that you have for us about anything that we presented on. And you're welcome to put it in the chat, or you can come off of mute if you have a question. I have to give it that like awkward minute just in case somebody's still thinking of a question. Okay, maybe our presentation was just very thorough. Okay, give it one like 30 more seconds just in case anyone has a question that came to mind. No problem, Chris. All right, we will make this available on our YouTube just as soon as we finish recording and upload it to our channel. And we will also be sending out some blog posts. And if there are folks on this call who really want to make sure that they're at our early childhood, early care and education rally, please send me an email. I'm going to get those invitations out soon. We're hoping to have lots of folks there who can celebrate with us at the Children's Museum of Richmond on July the 15th in the morning. And we'd love to have you there. Thank you everyone for joining us and have a great rest of your day.